Hello and welcome to my channel. In this lecture we'll be discussing the nerves of the pelvis, so let's begin. The sacral nerves, remember we learned in the abdomen that we don't go to plexuses immediately. No, we have to consider the dorsal rami of the spinal nerves. The same here applies to sacral nerves. We will talk about dorsal rami and ventral rami. So the sacral dorsal rami are small and they pass through the posterior sacral foramina. They divide into medial and lateral branches to cover a strip that it supplies of skin. And this applies to the sacral nerves except the S4 and 5 and CO1 that form loops of the sacral nerves. The sacral nerves, dorsal rami, supply the posterior gluteal skin, and the S4 and 5 and CO1 supply the skin over the coccyx. And as you can see here, these are the coda equina inside the spinal canal. Remember, the spinal cord ended level between L1 and L2. And see how the sacral nerves go out of the sacral foramina. In this case, we are looking at the anterior sacral foramina, because now we will be discussing the sacral ventral rami. The sacral and coccygeal ventral rami form the sacral and coccygeal nerve plexuses, and the upper four sacral nerves pass through the anterior sacral foramina, while the S5 passes between the sacrum and the coccyx. Remember this. And of course, like any spinal nerve, it has gray rami communicantis with corresponding sympathetic ganglia, and the output, the parasympathetic outflow, is through S2, 3, and 4. They are called the pelvic splanchnic nerves. Okay? So here we can see the sacral nerves passing, the ventral rami passing through the anterior sacral foramina, forming the sacral plexus. And remember that the parasympathetic outflow is through S2, 3, and 4. The nerve plexus, the sacral nerve plexus, formed by lumbosacral trunk, which is L4 and 5, and S1, 2, and 3, and the upper part of S4. So it's a big plexus. See, this is the lumbosacral trunk, L4 and 5. This is S1, 2, 3, and the upper part of S4 forms the sacral plexus. The rest, the lower part of S4 and 5 and CO1, form the coccygeal plexus. Now, all the nerves from L4 through S3 divide into ventral and dorsal divisions. It's rather, different arrangement than the lumbosacral plexus we discussed earlier in the posterior abdominal wall. The relations of the sacral plexus, it's on the posterior pelvic wall, of course, anterior to the piriformis, but behind the fascia of the piriformis. Remember this, the nerves were behind the fascia, the vessels in front of the fascia, and it's posterior to sigmoid colon and rectum. The superior gluteal artery passes between the lumbosacral trunk and S1. Inferior gluteal artery passing between S1 and S2. This is a multiple choice question. The superior gluteal artery passes between lumbosacral trunk at S1 on its way to exit the pelvis, and the inferior gluteal artery passes between S1 and S2. The branches of the sacral plexus are arranged from dorsal divisions and ventral divisions. Some nerves, like the posterior femorocutaneous, arise from both ventral and dorsal divisions. The superior gluteal nerve is L4 and L5. S1 passes through the greater sciatic foramina above the piriformis, as you can see here. This is the superior gluteal nerve. Remember, it divides into superior and inferior branches. We will study this in details in the gluteal region of the lower limb, and supplies the gluteus medius and minimus and ends in tensor fascia lata muscle to supply it. The inferior gluteal, on the other hand, L5, S1 and 2. I told you before, don't stick to the root value as said here. This is the what's mentioned in grays, but it differs in books, so according to the source you're studying from, but it won't be much difference for the root values. The inferior gluteal passes through the greater sciatic foramen. See, below the piriformis, this is the inferior gluteal nerve on its way to supply the gluteus maximus, as you will see here. The common perineal nerve is L4, 5, S1, and 2. It will either arise by itself, and in this case it will pierce the piriformis. I've seen this in dissections. Or it should be, in most people, it will join the tibial to form the sciatic nerve. This is the sciatic nerve. Nerve to piriformis, of course, to supply the piriformis. The posterior femoral cutaneous nerve, and it's a thick nerve. You will be surprised when you see it in dissection. It's a thick nerve. It comes out of the greater sciatic foramen, either behind the sciatic nerve, or besides it, the posterior femoral cutaneous nerve. It gives off gluteal branches, perineal branch, don't forget that, as it descends. It gives perineal branch to supply the perineum, and supplies, of course, the back of thigh and leg down to the, it reaches to the middle leg and leg branches. Perforating cutaneous branches pierce the sacrotuberous ligament. These are different, separate nerves than the posterior femoral cutaneous. Pierce the sacrotuberous ligament to supply skin over the area in the inframedial part of the gluteus maximus area. Okay. From the ventral divisions, we have the nerve to quadratus femoris. You will study this in the gluteal region, together with the inferior gemellus, and root value is L4 and 5, S1. It leaves the greater sciatic foramen and descends to supply the quadratus femoris. And by the way, it's the deepest structure in the gluteal region. It descends right behind the hip joint. You will study this also in the gluteal region. The nerve to obturator internus, on the other hand, comes out of the greater sciatic foramen as well. It's L5, S1, and 2. It's destined to supply the obturator internus and the superior gemellus nerve, superior gemellus muscle, and it curves around the base of the ischial spine. Now we have three structures curving around the ischial spine. The nerve to obturator internus around its base, the pudendal nerve around its apex, and the internal pudendal vessels in between. Remember this, because this is also a multiple choice question. The nerve to obturator internus curves around the base of the spine, base of the ischial spine, lateral to the pudendal vessels, and then enters the lesser sciatic foramen to supply the muscle. Enters the lesser sciatic foramen. So it goes out through the greater sciatic foramen and enters the lesser sciatic foramen. Why? To bypass the levator ani muscle. It can't go directly from inside the pelvis because of the levator ani muscle occluding the area. It's the pelvic septum, as you remember. Tibial nerve, it's L4, 5, S1, and 2, and 3. And again, the posterior femoral cutaneous nerve, because it takes from both ventral divisions and dorsal divisions. See, this is the posterior femoral cutaneous nerve. The pudendal nerve, a major nerve, S2, 3, and 4, passes through the greater sciatic foramen and curves around the tip of the ischial spine, to enter the lesser sciatic foramen, and finds itself in the ischiorectal fossa in the lateral wall, running in a canal formed by the obturator internus fascia, which is the pudendal canal or the Alcock's canal in the lateral wall of the ischiorectal fossa. At the beginning of the canal, we're talking this direction. At the beginning of the canal, it gives the inferior rectal branches, see, in the posterior part of the canal, to supply the external anal sphincter, lower part of the anal canal, and the perianal skin. Anterior part of the canal, in the anterior part of the canal, it gives off a perineal branch, see that? It gives posterior scrotal branches, muscular to the muscles of the area, like the superficial and deep transverse perineal muscles, the external urethral sphincter, the bulbus spongiosus, ischius cavernosus, muscles in the superficial and deep perineal pouches, nerve to the bulb of the urethra in males, and the external anal sphincter and levator ani muscles. It becomes the dorsal nerve of the penis or clitoris in females by passing between the subpubic ligament and the perineal membrane between both, and becomes on the dorsal of the penis to supply the skin distal till the glans penis. And the same applies to the clitoris. This is the pudendal nerve. The pelvic splanchnic nerves, S2 and 3 and 4, nerve to arises with, this is the parasympathetic outflow, arises from the lateral horns of the sacral segments of the spinal cord. We mentioned this before. The lateral segments of the horns of the sacral segments of the spinal cord are the parasympathetic outflow, not the sympathetic like what happens in the thoracic and upper two lumbar spinal cord segments. Nerve to levator ani, this is S4. It passes between levator ani and coccygeus. It gives cutaneous branches to skin between the anus and the coccyx. The sciatic nerve, a huge nerve, 2 centimeter thick nerve in the gluteal region, you will see it. It's composed of the common perineal nerve and the tibial nerve taped together by connective tissue and pass through the greater sciatic foramen below the piriformis. There is a procedure called the pudendal nerve block. It's used by obstetricians in labor, in which they introduce a needle in the vagina and inject laterally at the level of the ischial spine and sacrospinous ligament to anesthetize the pudendal nerve. This is called the pudendal nerve block. You will perform it. It's performed frequently in labors with obstetricians. Coccygeal plexus is S4, S5, and CO1. It supplies the skin over the sacrotuberous ligament after piercing it. Autonomic nerves of the pelvis, parasympathetic. The ventral rami of S2 and 3 and 4 join the sympathetic pelvic plexuses, means the inferior hypogastric plexus. Actually, it's together with the branches of the sympathetic chains form the inferior hypogastric plexus on the lateral pelvic wall. It's motor to the rectum and urinary bladder and inhibits sphincters, so it's for defecation and urination. The parasympathetic, we are talking parasympathetic, okay? Don't confuse that. It joins the sympathetic pelvis plexuses, but the parasympathetic component is responsible for defecation and urination. It causes contraction of the rectum and urinary bladder, inhibits sphincters. It causes vasodilation of all erectile tissue present in the penis or clitoris. and vasodilation to testicular, uterine arteries, uterine tubes, and ovarian arteries, and sends filaments to the hypogastric plexuses. Remember this, how we supplied the hind gut with parasympathetic. I told you it comes out through the pelvic splanchnic nerves, joins the inferior hypogastric plexus, climbs on the presacral nerves, and reaches the aortic superior hypogastric plexus, then the aortic plexus, then descends with the plexus around the inferior mesenteric artery. Remember this? We studied this in the nerve supply of the intestine. The sympathetic outflow, the pelvic sympathetic chains, as you can see them here. We continue our story of the sympathetic chains. We studied them in the neck and the thorax and the abdomen. Now the last part in the pelvis. They descend either anterior or medial to the anterior sacral foramina, and they end up joining in front of the coccyx, forming the ganglion impar. Ganglion impar means the only one ganglion that has no pair. Ganglion impar. Okay, in front of the coccyx. It sends gray rami communicantis to sacral and coccygeal nerves and to the inferior hypogastric plexus on the lateral pelvic wall as well. And this will be the end of the story of the sympathetic chains. Okay, I got a question before, an essay question, discuss the sympathetic chains. So actually you have to mention what happens in the neck, in the thorax, in the abdomen, and in the pelvis till they meet at the end to form the ganglion impar. The inferior hypogastric plexus, formed by the presacral nerves from superior hypogastric plexus, we know that. Laterally, it has the internal iliac vessels and branches and muscles of the lateral pelvic wall. Medially, in males, it has the rectum, seminal vesicles, prostate, and the posterior part of the urinary bladder. In females, medially, it has the cervix uteri, the vagina, and the posterior part of the urinary bladder. Now, preganglionic sympathetic fibers from lower 3 thoracic and upper 2 lumbar segments of the spinal cords are responsible for the preganglionic sympathetic branches of this plexus. I mean, they are the source of the sympathetic outflow for this plexus. And also don't forget that the inferior hypogastric plexus is joined by parasympathetic fibers from S2, 3, and 4. Now, the branches from the autonomic branches to the viscera are always direct or through plexuses around the vessels. And the autonomic branches form rectal plexus, vesical plexus, uterovaginal, and prostatic plexuses. Now, from the prostatic nerve plexus arises the greater cavernous nerve and the lesser cavernous nerve. The greater cavernous nerve to the corpora cavernosa of the penis, the lesser cavernous nerve for the corpus spongiosum of the penis, and the same apply to the clitoris, except the fact that the clitoris has no corpus spongiosum in it. Also remember that pain from the uterus and cervix differ. The pain from uterus is through the superior hypogastric plexus, and sometimes in untreatable cases of dysmenorrhea, sympathectomy is indicated to alleviate the pain. Pain from the cervix on the other hand, and remember the stimuli for pain from the cervix, it's only dilation. I mean, literally, you can't cauterize the cervix without the female feeling any pain. Pain from the cervix uteri is carried through the pelvic splanchnic nerves and sensitive only to dilation. This concludes our talk about the pelvic nerves. I hope that you got the maximum benefit from this lecture, and thank you very much for watching.